This is Gut Microbiota for Health, coming to you from Experimental Biology 2015, where I am speaking with Dr. Karen Edelblum of the University of Chicago. She studies the intestinal epithelium in inflammatory bowel disease. Dr. Edelblum, what does leaky gut or intestinal permeability mean in your mouse research?
Well, that's a really good question because different people interpret what barrier dysfunction really means. For me, I really look at it as the perspective of increased paracellular permeability, so the actual leak in the epithelium. But a lot of times people think of barrier dysfunction as any disruption of the barrier. So if there is an ulcer or if there's a lot of cell death, a lot of people think of that as barrier dysfunction, which is not necessarily, it's the difference if you had a break in a dam versus if you blew the whole dam up. So really permeability would be kind of more of the smaller, like the leak events, as opposed to a catastrophic event, like if you had an ulcer.
What are the mechanisms by which intestinal permeability can arise, and how are the gut microbiota related to this?
Intestinal permeability a lot of times is a sign of intestinal inflammation. So when you have inflammation, you have the production of pro-inflammatory cytokines, which can then induce an increase in permeability. And so it depends on the situation, whether if there is bacterial invasion, possibly, or changes in the intestinal microbiota may be able to cause those increases in permeability, or there may be a genetic component as well. We know that in for healthy first-degree relatives of IBD patients, although these people don't have IBD, that they do have increased permeability. And so we think that there's something that's specific about maybe the fact that barrier dysfunction may be a precursor to the development of disease, but we're trying to understand what those signals are and what causes that permeability and why does it not progress to disease in those individuals. So maybe it's kind of like cancer. So you would have maybe one mutation would be the first hit, and then you get a second mutation and you have cancer. So you think that perhaps having increased permeability is the first issue, and then you have another component, like a genetic component, that results in the autoimmunity that's only amplified because you have increased intestinal permeability. So if you would have an abnormal reaction to the intestinal microbiota that's amplified by having this leak, then that would be what induces disease.
Are you saying intestinal permeability is a necessary condition for the development of human inflammatory bowel disease?
Well, I think permeability is it's part of having inflammatory bowel disease because you have disruption of the barrier and you do have increased permeability. It's just a matter of when that permeability starts. And again, a little bit of how you define permeability kind of goes into that as well.
What are the clinical applications of this research?
I think a lot of people are trying to understand how we can amplify the barrier so that this leak does not kind of become like a pre-existing condition to developing disease. So if there are ways to therapeutically target barrier function and to prevent this kind of first hit sequence in the development of disease, then you may never get to the point where a disease will progress as a result of an autoimmune defect.
Thank you for speaking with us.
You're very welcome.